have the frontal plane, which divides the body into anterior and posterior. An example of a movement here is adduction and abduction. Next we have the transverse plane, which divides the body into inferior and superior. An example of something here would be medial and lateral rotation. The sagittal plane divides the body into left and right sections. An example of something here would be flexion and extension. And then we have the mid-sagittal plane, which is slightly off-center to the sagittal plane. And then we have the oblique plane, which is on an angle to the body. In the anterior-posterior axis, the pin is inserted through the shoulder joint, which only allows for abduction and adduction. In the medial-lateral axis, the pin will be inserted through the shoulder, which allows for flexion and extension. Here the pin is inserted through the top of the shoulder, which is showing the longitudinal axis, which only allows for medial and lateral rotation. Here we can see the posterior side of the character. Next, if we flip it over, this will be the anterior side. Look at the top half dividing the body through the center. This is the superior half, and this is the inferior portion. The proximal portion, which the shoulder joint is proximal and the wrist joint would be distal. Next we have medial, which is more towards the midline. And then finally we have lateral, which is the opposite and is more distal to the midline. First we will demonstrate flexion of the knee joint. And then this is the extension of the knee joint. Next we will do abduction. And then adduction is going back in. Elevation would be raising the shoulders, and then depression is bringing the shoulders back down. Protraction and retraction is specific to the jaw. Protraction would be bringing the jaw outwards, and retraction would be bringing it back in. Eversion is when the ankle rotates outwards, and inversion is when the ankle rotates inwards. Lateral rotation is when the hip joint rotates outwards, and medial rotation is back into the midline. Supination is when you're holding your hand out, palm facing upwards. Pronation is when the knuckles are facing up. Dorsiflexion is when you point the toes downwards. And plantar flexion is when you bring the toes upwards towards your shin.